Hello, everyone, and welcome. So, in these days of lockdown, we have so many changes going on, and then with the coronavirus, we at the Rotary Club by Root Cedars thought of having this special RotarX session to talk about the coronavirus and the vaccine. I'm pleased to see so many of you having joined us. I would like to just a few words about the Rotary. For those who don't know, it's Rotary is a network of 1.2 million members. We are dedicated on building a better world. Our motto is serving above self. We are around 600 members in Lebanon, 1.2 around the world, 35,000 clubs. And it's a very nice network where we really push each other and help each other to do good to mankind. Our club has 11 years of service and it's still ongoing. We've done projects for millions of dollars. And this year is really a year where we are doing our best. Our figures until now, from July till now, are more than $1 million in health and education, in building peace, in water treatment, and also in building better communities with the whole situation that's happening in Lebanon after the explosion and the economic meltdown that we have. Before welcoming our guests today, I would like to just send a small poll, as we're going to take 30 seconds. There are 3 series of questions that I would like you to answer, just to have an idea about these, how you feel about the coronavirus. So the first poll is going to start. I'm going to start them now. And the first questions we're going to have just about your feeling, how you know about the coronavirus. So please, 30 seconds. I need you to just, if you can answer to the poll in the audience, thank you so much. Five more seconds and we jump to there are 3 sets. So this is the first one. And thank you for having answered. There is a second one, which is about the changes our behavior. And I'm going to give it 30 seconds. If you can just help us sharing how you feel about it. Okay. Thank you. And the last one, which is related to the vaccination. If you can also give us your thought about it, that would be super great. Fifteen more seconds. And we're going to end the poll. Actually, I'm going to share the results with you. I should have shared. Okay, so we have, it's a 50-50 that are registered on the vaccination. Majority is willing to get the vaccination immediately when available is, interesting. So we have equally people that are willing to take it immediately and people that are willing to wait at least a month before taking the vaccine. So this could give them a good idea. And the people who will not take it actually are worried about the side effects. Okay, well, just also let me share with you first. So this was the information. We are considering ourselves somehow informed. We are very concerned, a big majority of us. Social networks is the main source of information. And going back to the second, changes in our behavior, a big majority of us is taking more, is washing more hands, wearing face mask at home. Okay, we're not the best examples for this one. A big majority are avoiding to do home visits. A big majority are respecting not shaking hands, and at a distance of 2 meters is the big majority, and also a big majority. So it's really, I think, our audience in here is very keen to know more about the COVID. This being said and done, Monsieur le Consul, I give you the floor.
Thank you, President. Good evening, ladies and gentlemen, dear friends of the Rotary Club Beirut Cedars. Thank you very much for being with us tonight. I think you all know more or less how a Zoom webinar works. So basically only two things that I should remind you. First of all, you can use the chat window to express opinions or share ideas. And you can also ask your questions during the Q&A session in the Q&A window. If you click on the little the little thumb, the question will go up. And of course, we will ask the questions with the highest score first. As you all know, the vaccination campaign is about to begin in Lebanon. And although overwhelming evidence shows that the vaccine is safe, misinformation and crazy rumors are all over the internet. DNA alteration, tracking devices, risk of infertility, etc., you name it. We all agree to say that this topic is incredibly divisive. Tonight, we have with us two renowned Lebanese specialists who will help us separate the facts from the fiction. It is now time to introduce them to you. Ladies first. So I start with Dr. Grace Abi Rizk. She has a master in epidemiology. She is assistant professor in family medicine at the Saint Joseph University in Beirut. She's also the chief of the family medicine department at the Bellevue Medical Center. She is the vice president of the Arab Board for Family Medicine Specialty. And last but not least, she is also the director of the Opération Septième Jour. She is an appreciated member of our club, of the Rotary Club Beirut Cedars. Dr. Grace, thank you very much for being with us tonight. Our second speaker tonight is Dr. Eid Azar. He is a full-time attending physician at the Saint George Hospital University Medical Center and an associate professor of clinical medicine at the University of Balamand. Administratively, at Saint George Hospital, Dr. Azar is currently the Chief of Staff and the Associate Chief Medical Officer for Safety, Risk Management, and Infection Prevention and Control. Dr. Azar completed his medical studies at the Saint Joseph University in Beirut, after which he relocated to New York to complete his specialty training in internal medicine at Cooper Health System, and subsequently his fellowship training in infectious diseases at the Albert Einstein College of Medicine of Yeshiva University and Beth Israel Hospital. After completing this specialty training, he moved back to Lebanon and joined Saint George Hospital and the University of Balamand. Since his return, Dr. Azar has assumed a number of various clinical, educational, and administrative roles at both institutions. In relation to the COVID-19 pandemic, Dr. Azar has been spearheading the St. George Hospital coronavirus response through his role as Chief of Staff. And to finish, on a national scale, he currently serves as a consulting member of the National Coronavirus Experts Committee, which is basically a committee established by the Lebanese government to guide policy and help decision-making efforts related to the pandemic. Dr. Grace Abi Rizk, Dr. Eid Azar, thank you very much for being with us tonight. We will start with 5 minutes of introduction. I give you the floor. Thank you. Maybe we can start by Dr. Grace.
Yes, good evening. It is really a great pleasure to be with you tonight. I would like to talk a little bit about our experience as doctors this few weeks. Of course, as a family physician, I had to treat a lot of patients, and many of them were really tired. What? Hello?
Yeah, it's okay, Dr. Grace. You can continue.
I had to treat many patients, tired patients. It was a really hard experience morally, and it was really horrible to see patient breathless, and it wasn't easy to find a place, hospitals, to find oxygen, so a lot of problems. And now we have the vaccine, and we see that many people, majority of them are reluctant to take the vaccine. While the vaccine is really a solution for this global pandemic. We see a lot of people dying, and the vaccine is a solution. So I hope that everyone will register and will take the vaccine, because it is really safe. We don't know if it is safe on the long term, on the long run, but we know that we need months or years to say that the vaccine has no side effects on the I don't know, at 5 months or 6 months, but what we know that they are effective, and the efficacy it's about 90, 94, 95%, and it helps us to have antibodies to kill the virus. The side effects are really minimal, and what we hear about DNA and the vaccine will change our DNA. This is not true. They are really safe and really recommended.
Thank you very much, Dr. Grace, for this introduction. I will now give the floor to Dr. Azar.
Hi, good evening. So I would, let's start with a few ideas about vaccination in general. So actually vaccines in the history of medicine, they are the most efficient thing that we ever did. It's estimated that vaccination gained us 10 years of average increase in life expectancy. All the modern chemotherapy would not give you even less. All chemotherapy may even give you less than than a year or so. So just from a public health perspective, you have to understand that vaccination is a major thing. Having said that, not all diseases are easy to produce vaccines against. So there is some disease that they are by definition highly immunogenic. For example, if you get hepatitis A once in your life, you cannot have it twice. So it's one time you get vaccinated for hepatitis A, your chances of getting the disease becomes 0. On the other hand, there is diseases that they are by definition poorly immunogenic, and coronavirus is one of them. And the reason is simple. It's an RNA virus that changes a lot. That's one. Two, we share the same virus with animals. So there's an animal host for the and this is common also. It's also the same thing for influenza. So it can have multiple hosts which can mutate and change. Therefore, it's not easy to come up with a vaccine for corona. So had the most interesting idea to fight corona is vaccination? Maybe not. And just to explain this, although I'm just disclosed that I am for vaccine, I would take it as the first person, but let's give it a perspective a little bit. If you take countries like Korea, if you take countries like Japan, where only in Japan, the zero prevalence of the COVID-19 is only 6 per thousand. So only 6 per thousand Japanese contracted at maximum, contracted the coronavirus so far. And they did that even without doing a mass testing nor major restrictions. So they still, as a nation, COVID-free more and less. So they can have more time to decide what to do. They may, somebody would question why we didn't invest in a good antiviral using the approach of early diagnosis, early treatment. You take a medication that kills the virus and then decreases the chances of you getting the complication of going to the hospital or getting to ICU. All of this theoretical thinking could have been debated had we didn't become a highly endemic place. So the vaccine in Lebanon, we estimated, I'm not going to go over the numbers now, but our numbers is pretty much saying that 26%, at least 26% of Lebanon has been already infected with COVID. This means that corona is already here. So this was not the story in April and May. So in April, when you closed the country, we averted the first wave. So really, we aborted all the dynamics of having an outbreak on the first big wave in COVID. We continued to trace the virus to some extent. If you remember well, there was time where the news was about, we closed this village, we opened that village, we almost knew who infected whom. And this is some sort of a tracing for the virus. So we were good at keeping the control of the transmission. Then we start opening the country June, July. We became sloppy, and the test and trace program of the Ministry of Health was not did not keep the pace with the growing epidemic that started in August. Then you know all the rest of the story. Add to it, there is definitely a mutant factor. So we tested viruses from October, 19 virus, there was 0 English mutants. We tested another 63 virus that were collected at our hospital from December 28th to January 6th. 57% had the signature mutation of the English variant, which tells you that the complexity of how outbreaks and epidemics happen are not as simple as just people not compliant with masks and all of that. I know that we are not renowned in Lebanon to being disciplined and use all the distancing. And during the holidays, there was a part of the dynamics was induced by the fact that people went to dinner together and to close parties and so on. But there is much more complexity into the epidemic and how epidemic happens. Bottom line, now we reach a level whereby it's next to impossible. And I'm one of the people who said from the beginning, test, trace, meaning do not let the virus circulate, because the Chinese knew that. That's why the Chinese closed Wuhan, which is a 1 million inhabitant city. They closed the economy of 1.4 billion person because they knew that you cannot let the virus go on its own, and that's why they succeeded, as the whole Asian succeeded into the control of the virus. The more Western-minded, they went into this mentality of letting the corona circulate the same way you approach flu, and then try to treat the sickest. And now we know it's a horrible decision. At any rate, once you become endemic at this level, you cannot, and there will be no way for us to gain control again, unless a mutant happen, which is the opposite of a bad mutant, because not all mutations are bad ones. So unless the virus decided to go on its own, you are now in a status whereby corona is part of your life. It's everywhere, and you're going to keep losing. Maybe in the next 2 weeks, you're going to start to see less cases. But at any rate, you're going to continue to see people dying from COVID. So if you are in this situation, and this is the kind of mentality you should apply, it's the mentality of military medicine. You are in a war now. You don't use the same principles or ideas you use when you are at peace. So the principle of precaution, which is guided all medical field in the last 50 years at least. So we decided to come up with this for good reasons, probably, is to make sure that what we are doing is 1,000% safe, and then we look for efficacy. If you want to apply that mentality, you're not going to be able to do any vaccination plan. So now the vaccine, you have to venture into the vaccine with the idea that we are in a war. 25%, 26% of Lebanon already had some form of immunity. We know it's not a long-term protective one. If you want to wait for herd immunity to reach the 80%, by the time we reach that in 2 years, the first 25% already lost their immunity. So to be a vicious cycle, and you're going to see people dying continuously, and you're not going to be able to operate schools, economy, and so on. So your best hope or your best bet is that you induce some form of artificial immunity, and you do that by vaccination. So vaccination, now there is 3 categories for vaccines. There is one of them, which is the mRNA vaccination. And maybe 10 years down the road, we will be very happy for what happened in this field of mRNA vaccination, because as you may know, this has been developed historically to deal with cancers. So the idea was to, instead of taking chemotherapy, I give you one protein, the code of one protein that a cancer cell would expose, and then I give you the vaccine and I can spare you a chemotherapy. So maybe that technological advancement of mRNA turned out to be one of the good things that happened from COVID, and it's the research in that field has been stagnant for years. But once we had this epidemic and the billions of dollars that were paid for vaccination, at least it's a breakthrough technological. How much it's gonna be effective for COVID? So the efficacy now with that is the idea that most of those, both Pfizer and Moderna, they target the spike protein. So you will induce an immunity, significant immunity against this protein. But if you are unlucky, or we are unlucky, and a big change happened in that protein, you may lose and we already have the Brazilian variant, since everybody now is familiar with variants. The Brazilian variant, it's the only city in the world whereby it was declared as herd immunity, with 65% of its population being IgG positive, experienced a second wave of COVID. And then when I looked it up, they found out that this one that's circulating in that town in Brazil actually has a mutation whereby the virus can escape the neutralizing antibodies that even the disease or even a vaccine can give you. So if you put too much bet on one mechanism sometime, so either with the Moderna and Pfizer, either we're gonna win a lot, or we may lose quickly a lot. The second one is what we call now the Chinese. So the Chinese, they went for the safer bet. So they used the oldest technology, which is inactivated protein. And so they have a cocktail of proteins in their vaccines. And it's the opposite idea, which is you don't gain too much immunity, but you don't lose too much because you're not going to have mutations for all of those cocktails of proteins. The third one is the adenovirus based. So it's another technology whereby you take an adenovirus, it's a chimpanzee adenovirus, which is not really pathogen for us, and you inoculate the the RNA of this virus with the code of COVID-19, and you give it to the body. So this is what referred to as the Sputnik, the Russian and the English one. So the AstraZeneca. The advantage of the third one is that it can be massively produced and it's cheap. So those are the three available things that, that the three pillars of vaccination. So if you are thinking from, and vaccination can be seen from two angles. From a personal angle, it's at the end of the day, there will be no way to make it mandatory. So it's something that will be actually voluntary. So people will make decisions for their own. And if somebody is just too much worried about side effects that may happen three years down the road, you cannot argue with them. But my simple answer is like, we cannot afford thinking 3 years down the road. We need to think about the next 6 months. So from a public health perspective, this is the other side of the argument. If you look at the 6.9 million people who live now in Lebanon, and what you need to do, you need to come up now. I'm not too worried about the availability of vaccines because there will be enough vaccine. I am worried about the logistics of how to administer the vaccine. So there is one big problem is going to be about how you take appointments, how you go. It's not a simple thing. So a lot of countries struggled with this. We have already a very high level of bureaucracy. We have a very high level of corruption. We have a very high level of also superstition. So all of those, they're going to be major problems in vaccination. I will finish with one idea that people confuse sometimes, which is the efficacy versus the effectiveness. So the efficacy of the vaccines, it's made on those studies where you take 40, 50,000, 80,000 person. The Pfizer one was 44,000 participants divided into two groups. And you look for 3 months and you see how the number of infections that were detected in the people who took the vaccine and the people who didn't take the vaccine. That gives you an efficacy. But effectiveness in vaccination, it's a different concept, is how you take this efficient molecule and you can administer to a very large number of people. And you go through those old problems, like I said, superstition, you have to be well educated, you should not waste too much time. The anti-vaccine group are very ideological. So if you go into too much argument, you cannot win. And I respect their opinion as part I can respect any human, but it doesn't worth doing a large arguments with the people who are ideologically against vaccination. You cannot win, you cannot go nowhere. You end up just talking and repeating the same ideas. You have to facilitate the process, because if the process is not easy, that would be another problem for people not to go through it. And you have to be transparent and to be guided by numbers. So people, for me, to mobilize them to get more vaccines, you have to show them in a short period of time how this vaccination plan affected the mortality rate, admission to hospitals, and so on. So I will be taking the vaccine the soonest I get it. And this is another, some people laughed about it as when you saw all our friends in the States putting their Facebook account full with their biceps being punched. But this is one way to show that it's skin in the game. And if I take it, that makes more people comfortable to say, okay, we'll do it. A lot of work needs to be done in this area. And then we all hope that it would be a game changer, meaning 5-6 months, something like that, we can gain 25-30% immunity additive to what we have, and then we start to approach a level whereby the circulation of the virus is blocked by people who are immune and cannot and won't transmit the virus. Thank you.
Thank you very much, Dr. Azar. Very interesting introduction. Actually, my first question was about the different types of vaccines, but you just answered it. So maybe I can ask a question to Dr. Grace before getting back to you immediately. Dr. Grace, we have noticed over the last few years an increase in the number of people being against vaccines. We see more and more people refusing to give the vaccine to their children, etc., etc. And here with the COVID-19 vaccines, I think we have never seen or experienced such a divisive debate about the vaccine. How do you explain the level of activity by the anti-vax community?
Okay. First, of course, we have a lot of people who are anti-vaccines, but we know that the majority of Lebanese people they get vaccinated their children, but when it comes to vaccinate adults, this is the big problem here, and the coronavirus, because we have new techniques in fabricating the vaccines, so people are afraid, and we are listening to the media, to the social media, and they said, "Oh no, don't take it," but they don't. They are not aware of studies done. You know, we can see like during the day you have
8:30.
Session about the COVID vaccines, and they are talking against, and they are against or with the vaccine. So we get lost with all the information, and that's why they don't feel like they have the good information about the vaccines, and they are afraid to do it. Don't you think, Dr. Azar? This is the explanation.
As I said, and I try.
Do you share with me?
Yeah, but I think is less interest should be put on a big argument with the anti-vacciners. You know, I know the anti-vacciner group since my days in the States, and they are very ideologue. It's a belief. So
yeah, but they are not the majority of people. So
because they can occupy the majority of the media conversation if a big conversation is around is it or shouldn't and all of that. So at the end, since a personal choice is the pillar of the vaccination, you should focus on the people who are consenting and willing, and keep the conversation very simple. And myself, I wouldn't say that based on the principle of precaution, I'm 3,000% sure of the safety of the vaccine. I wouldn't sell it this way because I don't believe it's in it. You cannot tell people something that you don't know. But on the other hand, I can easily say, no, we are out of options. We are really out of options. Your choices is A, you continue to be the way you are, and then you have, instead of like 60 dead people per day, now you go drop to 20, 30, but you're gonna see people dying every day. It's gonna affect all aspects of life. Or you wanna take a shot into this collective experimentation, it's called vaccination. So that's my opinion. I think it's just keep it as simple as this in terms of the rationale why you should get vaccinated. You have to accept scientific microbiological data that COVID-19 is not hepatitis A, is not something that you take the vaccine and it's done, you're done with immunity. We know it's complex. We know it's the variant is something that's going to be part of COVID-19 as long as we have COVID. So we should not also disregard that part, but this is not something that should stop us from the vaccination plan. And work the logistics, because people spend too much time about this theoretical debate, but if an easy access, a simple way to register, a simple way to get the vaccine, a clean way to get it, people will go and do it. If it's going to be a bureaucratic circus, that would let people not do it. And then we try, as the introduction said, I advise some for the government, but it's something that you cannot. I know for now for sure how it works. You cannot control all this complete chaotic bureaucracy of the Lebanese government. You can write books about that. And the problem is, if you let them, if the way I see it happening, the major obstacle will be not all this problem of logistics, and another big problem for the non-government people, because a lot of those organizations now, they're thinking about making a PR out of a vaccination plan. So the whole super excited about vaccination. They want to look good by offering the vaccine, and it's going to backfire, because all the big companies, at least the Western companies, they're not going to give you the drug. One, you cannot sell it, that's for sure. You cannot accept an equal access to the vaccine based on rules. On the other part, I'm not sure if the Chinese or the Russian will play by the same rules. So you may have, in the next 3 months or 6 months, different campaigns of vaccination. Some of them, they will bring, because most likely the Russian will play the diplomacy game with the vaccine. The Chinese will sell whoever who comes for them, and you're gonna have opinions right and left against the vaccine with the Chinese. Somebody would like the so that's my main worries about how to vaccinate Lebanon.
But with this pandemic, global pandemic, where we don't have really a choice, so the vaccine is a solution. And unless we're gonna continue to see the number of deaths, so when we said that the vaccine is safe, it's according to studies done on vaccines. So our duty as doctors is to encourage people to be vaccinated. Bureaucracy maybe we're gonna have some issues with bureaucracy in Lebanon, but we have to try. And the campaign will start next week, and we'll see. We can adjust.
We have a lot of questions arriving. So one of them was about the timing, but I think you both agree. People were asking, do you advise us to wait, or do you advise us to take the vaccine as soon as possible? But I think the answer is quite clear. Now, we have also many questions about the different types of vaccines and the fact that they can not adapt, but they can be efficient against all the different variants of the virus. So how, what determines the level of efficiency of a vaccine against the different variants of the virus? I can ask the question to both of you.
So just quickly, so definitely it's not as simple as your IgG level. Even in the studies, the published studies about the vaccination, they did not trace a detectable immunoglobulin. That's the blood test that people do for immunity for the vaccinated. So the endpoint in the study, and I said this is the efficacy, was just see a clinical cases. So if you are vaccinated, what are your chances to develop a clinical disease? So it was cut by 90% or 60% or 80%, depending on the numbers that you hear on the media. So on 3 months, let's say, if you have an X chance of getting COVID, that chance is cut by 90% in the modeling of a controlled study. So how can you translate this model of efficacy when you go into a population-based that's a different game, because like for all the problems that we talked about. Two, there is other aspect that that cannot be studied. Some of them are around the idea of the memory cells for immunity. So your body, when it reacts to the disease or the vaccine, it's not only just the detectable level of immunoglobulin. It's probably there's a much more complex mechanism, an interesting mechanism, whereby your memory cells, there's some cells specialized in keeping a library of whatever vaccine, viruses or vaccine entered your body, and that will be in the memory of your immune system. So once they are exposed again, they will act and protect you. One other big aspect that is not well studied, also we don't know it, is if you cut the disease, okay, do you cut the transmission? So maybe there will be a model whereby if you're vaccinated, you can carry the virus, but you don't get the disease. So that's another thing that we don't know answers for. And you can design, Indonesia, for example, they decided to vaccinate the younger people. Maybe they will end up being right. So all the other part of the world, they said, let's protect the elderly. The Indonesians said, okay, no, we're going to start with the younger. They are easier. Two, they are the real transmitter in the society. So if you can get that, and that's, I'm not going to be too technical, but once we did the pneumococcal vaccination in kids, the mortality of the elderly with the pneumococcus went down. So if you vaccinate the children, sometimes you save the granddad. So there is a lot of complexity in this thing, and you add to it, you're doing a vaccine for a virus that you don't control. He can change anytime a set of conditions are met. So the argument is not, I wanna document to you that I know that you will take the vaccine and life will be fine in 2 months. The argument is, if you don't want to do vaccination as a public health, not as an individual, what other options we have? So Koreans, they had the option. So Koreans, they said, we're gonna wait. We're gonna watch the English, the Israeli, all these countries who are doing some serious mass testing, what's gonna happen to them. And once I'm gonna know all the pitfalls, I'm gonna vaccinate my people. The Chinese are more or less the same mentality. Switzerland, though they have cases, but they are more accepting than some people even accept. There's another layer in the story, which is how much the society accept death. So, and even in Lebanon, 50% of the dead people are above 75. So the only subgroup who have an excess mortality, a significant excess mortality, are the elderly. Plus a little bit probably middle-aged men, 50 to 65, and most of them are obese. But if you put this aside, you can say, and this is again public health, I'm not talking about my grandmother or my family, I'm talking about the health of millions. Okay, some society, the Swedish decide with their initial model of herd immunity, their argument was, okay, we're gonna accept that some old people will die. So wait or not to wait, because if you wait, you will know more. You do it based on how much you can afford. So in my opinion, we cannot afford in Lebanon to wait more. It's already stressed out economically, it's stressed out hospital-wise. It's a vicious cycle. Even people now a little bit compliant with the lockdown. But if we continue like this another 2 months, people are not gonna be, there'll be riots. I don't know what's gonna happen. So, so based on all of that, my argument is by necessity, then get yourself vaccinated.
According to Pfizer and Moderna, their vaccines are effective against the new variants of COVID. When it comes to AstraZeneca and Johnson & Johnson, They talk about 50 to 50%, 50 to 57% of efficacy against the new virus. So maybe Pfizer and Moderna are the best two vaccines against the new variant of COVID.
We have a lot of questions of the attendees about the choice. Some people ask, okay, should we try to get this vaccine rather than this one? Should we try to wait a little bit until the other vaccine is available in the country, etc.? So if I understand correctly, you advise us to take the first vaccine available?
Yes.
Okay, and
take the vaccine available, and also we have to discuss with our doctor which one, for example, for AstraZeneca vaccine is for those under 65. So it depends. We have to discuss with our doctor which type of vaccine is better for us.
I also have other questions about something interesting. Some people ask, would it be more effective to take two different vaccines? Or if we do not develop antibodies with a first vaccine, I don't know if it's possible, not to develop antibodies, to try to make a second try with a second vaccine. What's your opinion?
Definitely. So actually, Wall Street Journal yesterday had a nice piece about cocktails of vaccines, which is probably what you're going to end up doing. And this is just here a personal opinion. It's not backed by any data. It's just for the way I imagine things happening, especially when you deal with a virus that has all this capacity to mutate. So if a partial response in terms of immunogenicity happen at the nation level, and that's not a static one. One, you lose it over time. Two, you can have any change. So now they will tell you, we're efficient against this variant, but you don't know what other the variants. So even in one patient, there was an article in Nature 2 days ago documenting that's like HIV. Actually, you can have subtypes of viruses in the same host. So the same patient can have different subtypes. So it's a lot of complexity in that area. So if you will get a certain immunity from A, and if you want to have a scheme, and it's not a recommendation, it's just ideas, since you asked, you may take the Chinese for, bread and butter immunity, since it's a plain old technology, and pick up another one for your more immunity against a spike protein. We will know while doing things, but what I don't advise is to be focused too much on the immunoglobulin level. It's going to be the same story that the Lebanese people were stuck with the CT level, the one that you do with the PCR. They analyze CTs and they have, 2 hours conversation if it's CT 22 means. So it's almost meaningless on a single level to read your immunoglobulin level. So it shouldn't be something that you do and then you test, and then 2 months you see if your immunoglobulin is still high, and then you take another job. The rationalization of the process should be as simple as availability. So if you want to see how availability in Lebanon is going to be, Pfizer will be shipped Saturday. So Saturday we'll receive the first Pfizer dosage. There'll be 22,000 doses, and it will almost go all of it to healthcare workers. So when the schedule with the company goes as it was advertised, so it's going to be a sequence of multiple doses, weekly doses that's going to come from Pfizer. The second in line through COVAX, which is is going to be AstraZeneca, but now you're going to start more hearing about, should we take Astra, should we not take Astra? Sputnik would have been based on what they reported, a good option, but I don't trust that there is a transparency, even if they will tell you when they will give it and how they will give it. There's 5 or 6 people trying to get a Russian vaccine, but nothing is concrete yet. But in the adenovirus, if something is going to be available, it's going to be in 1 month. And the Chinese, also the army actually going to get the Chinese. So that's another, not completely finalized, but the army might buy a Chinese order, which also not that, like, I'm just giving you an example about how pragmatic should you be, because if you want to vaccinate young army people, neither Moderna nor Pfizer will give you priority for young people. And if they want to wait, it's going to take forever. And if you want to, so you may buy the Chinese, which maybe they're not the most protective, but it gives you some. And it's as easy to use as Vaxigripe, if people remember how they take. So it's even, you can give it to the people to take it at home. So there is a lot of scheming that you can do with vaccines. The problem is there is no one centralized or, you know, chef d'orchestre somehow that decided all of those. It's pieces here and there. And, you know, add the bureaucracy of Lebanon, add the superstition, add the corruption, and add the, what you're gonna call it, people just, you know, act as they are, pretentiousness of the society. I think we're cooking pretty much a nice circus with the vaccination.
So encouraging.
I'm just
Bureaucracy is everywhere, Doctor. Doctor,
there is few places in the planet they have every. The French have the bureaucracy, but they're not.
French people, yeah.
They're not superstitious, so and less pretentious probably than us. You know, in Africa you may find corruption, but definitely not pretentious. They'll bring somebody to do the job. So here, you know, they want to do the job themselves, and you know, it's all chaotic. Anyway, I'm again back to the subject. Vaccinate yourself with the first available.
Yeah.
Don't try to over-calculate it. It's something that you cannot calculate, and it's and hope that this would be our way out. So 2021 is the year that's going to determine the next 5 years. So if vaccination works somehow in 2021, you know, that's, you know, you're going to have a back to normal life at some point. If the vaccination in general turn out to be a failure due to all the factors and all the unknowns that we talked about, then prepare for a longer dark period.
I have a double question. So of course it's still maybe too early to say, but how long do you think the vaccine will serve as protection? Do you expect that we will have to take the vaccine yearly, like the seasonal flu? That's the first part of my question. And then something interesting as well. Even after you get the vaccine, is it still possible that you are contagious, that you can transmit the virus to other people?
Okay. We don't know yet. We don't have data on our immunity. How long does it last? Our immunity. We know that after the second shot, people have a good immunity, a good response to the vaccine. But for how long, we don't have answers. So maybe maybe now with the vaccinations done all around the world, we can see, we can check 3, 4, 5, 6 months later if people still have the antibodies. But as Dr. Azar said, that we have the memory cells also. They have a major role here to fight COVID once we are exposed to the virus again.
Actually, yes, it's a very complex question that one, we know you're going to lose the immunity because you lose the immunity for the disease itself. So if I give you the whole virus and you cannot have a lifelong immunity, you're not going to get it from a vaccine, that's for sure.
Yeah, this is with the Chinese one, yes, of course. We know.
The whole you know, you don't mount a permanent immunity against COVID, against all corona, not COVID. The question is, if you build a barrier, quick barrier, for a large number of people with some immunity, not even a full immunity, And that barrier breaks the transmission cycle, meaning when I pass it from me to somebody else, if that X is immune, chances of the virus to continue to circulate becomes smaller. There is an epidemic, in outbreaks in general, all the time they die on their own. WHO did nothing to stop the Ebola. It stopped on its own.
Yes.
SARS is the same. So I think it's a lot of us to discuss a level of complex biology that's from the virus and that we know that we don't understand completely, or even remotely we don't understand it. So what you can do, and the idea of people who are thinking about theoretical model of vaccination, is for a short period of time, and Israel is doing that experiment in the fastest way, is to say, over a short period of time, if I have a large number of people somehow have some defense against the virus, I will block its transmission. Your second part of the question is actually the antithesis of that thinking, whereby maybe your immunity against this virus protects you to the point that you don't feel it, but you can have it in your oral secretions, and it makes you actually a worse transmitter because you're not going to feel it at all. One. Two, you're going to feel that you're protected, so you're going to behave less, and then you may pass it to the people still. So that's why I said the biggest experiment in history of probably science is what we are doing now in the planet. If you take the pace of vaccination that's happening today, and if you take the other model whereby you want to vaccinate the 7-8 billion people living in the planet, it's going to take you 7 years. So, it's a lot of, we can go on and on with ideas about the complexity of the story. Some of it's going to be with this idea of medical passport for you to travel, which is going to be like some people do Photoshop for their PCR when they travel, and then so you have a paper saying I was immune, what this means, what really is something. So, and you're gonna have more richer people are able to do it, and then the less rich they're gonna be. So I think for the time being, we have to keep it as simple as we're already deep in the game in terms of control of the outbreak. One of the tools that may help us is vaccination. Try to get it fast and right, so we can hope that in 2021 we talk about something different. 22.
We have a few questions as well from people having some medical conditions like diabetes or high blood pressure, allergy to penicillin, allergy to sulfur. What would you advise to those people? Should they also get vaccinated?
Yes, as soon as possible. Those who have some kind of allergy to penicillin, those are no contraindication for vaccine. So they have to get vaccinated as soon as possible.
Yeah. So this is the exact, you get exactly the questions from people now, citing all their medical history. The more medical history you have, the higher urge you need to vaccinate yourself. So people, this is because now people tend to ask, if I have this disease and this disease, should I vaccinate? The answer is yes, 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 yes. If you don't have diseases, probably you may decide to wait. But we encourage you to do it simply because you may be the one that's transmitting the virus to somebody with a long list of diseases.
We still have time for maybe one or two questions. I have one interesting question. What percentage of the population needs to get vaccinated before we can reach the herd immunity?
80 to 85. It's 80 to 85%. Yeah.
Okay. And second question, will the vaccination scheme be fast enough in Lebanon to reach that herd immunity? Will we get enough doses of vaccine soon enough to reach this herd immunity in Lebanon?
You will get the vaccine dose. There will be more dose, in my opinion, than people, you're going to have the dosage. The problem is, do you have all the needles? Do you have all the space? Do you have all the documentation tool? Who's going to give the appointment? How to get the certificate? All those small details. Who's going to do the good advertisement at community level? This it is not. It's not a. It's not a disease for like. It's not a hospital level of disease. So you're talking about outreach in the community. Who's going to go and do and talk to people in the villages to tell them you need to get vaccinated? Who's going to facilitate the process for them? Where to park if you have 600 people coming to my hospital? If we get more than 500 people per day, you cannot walk on the street. So there's all these details that need to be worked out and facilitate the process. Keep it simple. Avoid theoretical discussions because they go nowhere. Like probably you heard, there is a million ways to see the vaccination, but in terms of at the end you need to make a decision. We can talk for hours about the pro and cons and what to do and what should be done and what this country did and what country didn't do. At the end of the day, I feel confident to say in Lebanon, after this large outbreak that we had over the last 6 weeks, the number of people who died, we cannot afford not to take a simple, clear decision: vaccinate yourself.
I think it's a clear conclusion. We still have questions, but I think we should stick to that conclusion. Dr. Grace, Abi Rizk, Dr. Eid Azar, thank you so much for your very valuable contribution. I will now give the floor to our president that will launch the poll again and see if the meaning of the attendees has changed during this webinar.
Thank you so much, Monsieur le Consul. Thank you, doctors. I will just launch one poll, and it's a very simple question. And here it is. If after this session, will you get vaccination when available? It's just yes or no, or still don't know. I'll be giving 30 seconds for this poll. In the meantime, I would like to pass my sincere condolences to the Rotary Club of Beirut and the entire Rotary family in Lebanon and the family of the late Assistant Governor Tony Hafiz. We just found out that he passed away from the coronavirus. It's really, this pandemic is taking the best of all of us. All our prayers go to the family of Tony, the late Tony, Assistant Governor Tony Hafiz. And we're going to end the poll. I think the results of the poll are clear. A big majority of the people are going for the vaccination. I would like to thank very much Dr. Grace Abi Rizk and Dr. Eid Azar for having given us all the time to enlighten us more, get us to know more about this coronavirus pandemic, how to fight it, how to protect ourselves. And we look forward to see you again in our next RotarX sessions. Ladies and gentlemen, thank you very much. Goodbye.